I think August this year. Yeah. Normally we end our semester. Now is semester 2. Normally we end it around July, but because we have extended the academic calendar, things are changed now.
I see.
So yeah, the students are now, they are basically on holidays for about 10 weeks, starting from 18 March.
Oh,
Hmm.
first we have until like August, I think. But for me, I don't have classes the entire sem.
Oh, okay. You're doing research?
No, I'm actually not from this course. I'm from ACCA.
Oh, okay.
Uh,
ACCA.
yeah,
Something related to accountancy, right?
right. But I'm
Okay.
interested in psychology, so that's why I'm here.
Oh, okay. Hopefully the talk will be beneficial for me and also for other people,
Right,
especially
right.
you. Yeah.
Yep, yep, me included. So I think we're gonna start now, okay?
Sure, sure.
All right, guys, welcome to Sunway Psychology Club Anxiety Awareness Month for the month of May. We would like to thank everyone for taking time off and being with us here today. And we're very, very delighted as we have a very special guest here today. Please welcome Dr. Jamilah.
Hello.
Thank you so much for a very warm welcome.
All right. So I actually can't see you though. So excuse me if I'm not like responding well. I can't actually see anyone right now. All right, just to give you guys some background and understanding and of what Dr. Jamila is about and what she has accomplished. Dr. Jamila has a master's in clinical psychology and a doctorate in psychological medicine. She's also currently an assistant professor at the Department of Psychology at International Islamic University Malaysia, also known as IIUM. Furthermore, she's a recipient of many, many research grants, such as the Transdisciplinary Research Grant Scheme and Knowledge Transfer Program. All right, if you guys have any questions for Dr. Jamila, you guys can start submitting your questions by simply keying the code or scanning the barcode, and it will get you to Mentimeter. Don't worry, all questions are anonymous, so you don't have to feel shy, and you guys can write whatever you guys want. Also, please try to be more specific so it's easier for her to address it. I'm gonna give you guys maybe 10 seconds. All right, now let's proceed to our first session for today. Our topic for today's session will be the symptoms and causes of anxiety. Now, we're basically going to do it in like a Q&A format. I'm going to ask Doctor some questions and she's going to try and answer them the best she can. And after this, likewise, you guys are going to have a chance to have your questions answered as well. So, Doctor, whenever you're ready,
Yeah, yeah.
I'll be asking some questions on
Sure.
behalf of Sunway Psychology Club. And you can maybe share your experience or educate us a bit on the topic. Is that okay?
Yeah, sure.
Okay, so I'll be moving on to the questions.
Hmm.
There's 8 of them in total here.
Yeah.
First question, is anxiety a hereditary disorder? Now, I find this funny, and because I'm also quite curious about it because I have this friend, and like I think 2 years ago, he used to tell me that he gets anxious whenever he goes to like the supermarket or like the bus station, and then he blames it on his dad. So, would you say that there's truth in this statement?
Hmm.
Would you mind maybe explaining, giving your ideas behind it?
Okay. So the question is whether we can inherit
Right.
anxiety disorders from our parents or our siblings or our relatives. Yeah.
Mm,
Well, my opinion is anxiety disorder is not totally hereditary disorder. There are so many contributing factors in the development and also maintenance of anxiety disorder. Pinpointing one causal factors based on research is not right. Yeah. However, part of the contributing factors in the development of anxiety disorder is biological factor. And
Mm-hmm.
part of the biological factor is also related to genetic or hereditary. Yeah.
Okay.
If if compared to someone who have no relatives with anxiety disorders, with someone who have relatives with anxiety disorder, the possibility to develop anxiety disorder is more among people who have relatives who have been diagnosed in anxiety disorder. So we need to understand that there are many contributing factors, not only one biological factors, which is hereditary or genetic. Some people, their anxiety disorders are triggered by psychological factors
Okay.
or sociological situations such as the socio-demographic situation, where does they live, their race, um, the way people treat the certain ethnics or races, that may also contribute to the development or uh, triggering of anxiety disorders. So if we would like to pinpoint that anxiety disorders is purely hereditary disorder, I disagree, because research also cannot confirm that only one causal factors of anxiety disorders, and that causal factors of anxiety disorder is hereditary.
Uh,
Hmm.
Basically means my friend lied to me lah.
Well, I think it's easier to pinpoint a mistake rather than to try to understand what are the reasons I developed this certain kind of symptoms. I think people, I think is a normal nature of human being that we tend to pinpoint certain mistake or blame certain people in order to make us feel safe, and
Right,
in
right.
order for us to make us feel like, oh, this is not because of me, it's because of other people.
They want to absolve
Yeah,
themselves of responsibility, right?
yeah, yeah.
True, true.
It- it's a lot
Continue,
easy.
continue.
Okay, yeah, I think that's all for the
Okay.
for the first question. So it is not purely hereditary disorder. My opinion is a combination of a lot of factors, and it can be biological contributing factors, it can be psychological contributing factors, it can be sociological contributing factors. And I think for the past few decades, a researcher in this area has started to conduct research on religiosity and spirituality, and they would like to see if religiosity and spirituality of someone may also contribute to the development of anxiety disorders. So there is no one single causing factors of
Right, right.
anxiety disorder.
You can't exactly pinpoint one area, right?
Yeah, yeah. Even if you see clinician, your clinician, your therapist, or attending psychologists or psychiatrists, medical practitioners will try to understand the holistic part of yourself, to make sure that we can totally understand about what are the factors that allow this to happen, and what are the factors that trigger the symptoms to happen, and what are the factors that maintain someone to continuously experiencing the symptoms of anxiety. So it is not like a virus, anxiety disorder is
Mm.
not like COVID-19. We know what is the virus. Oh, this virus, we can name the virus, and we are currently the researcher currently trying their best to develop the vaccination. So mental disorder is not like this kind of diseases whereby we
Okay,
can
okay.
immediately pinpoint, oh, this is the virus. So let's combat the virus with vaccination or any treatment.
Right, right, right. That makes sense. That actually makes a lot of sense. Now, can we move on to the second question?
Yeah.
So this one, right? A lot of people have been asking, like, How does one actually differentiate between being shy or nervous as opposed to actually having anxiety?
Okay. This is a very famous question, and also many people also confuse about shy, nervous, and anxiety. Okay, let's look at the definition of it's not definition, but the characteristic of shyness. Yeah, shyness or nervous is actually shyness is actually a trait of someone. Yeah,
Right?
when we talk about trait, means it is a stable characteristics of someone from time to time, from situation to situation, from different context to another context. So that is why we call shyness is a trait or a personality trait. Same goes to anxiety. Yeah, if we talk about anxiety, not from a disorder perspective. Yeah,
Mm-hmm.
anxiety also can be considered as a trait. For people who study psychology, they may have come across a big five personality trait. Yeah,
Right,
and
right.
part of this big five personality trait is neuroticism. And neuroticism personality include anxiety as part of its trait.
Mm-hmm.
Yeah, so anxiety and shyness can be considered as a trait, a stable characteristics of someone. But
Mm-hmm.
nervous is more of a state. We feel nervous when we are about to deliver our speech. We feel nervous when we are about to submit our assignments. We feel nervous when we are about to enter the examination hall. Yeah, but if we compare between shyness, nervous, and anxiety disorder, we can say that the main distinction is anxiety disorder are more intense in terms of the fear the person has. So the intensity are greater in people who have anxiety disorder. So people who have anxiety disorder, their worry, their fear is a lot more intense if compared to people who are shy and people who are nervous. People who are shy and people who are nervous, normally they still able to control that trait in order for them to function. Yeah,
Right, right.
but people who have anxiety disorder, normally it affect their functioning, and we have a lot of functions in our life. For example, I have a function as a mother, I
Mm.
have a function as a wife, I have a function as a teacher, I have a
Right.
function as a worker. So when I have anxiety disorder, this function is disrupted in a longer uh, duration of time. I do not necessarily nervous only before presenting
Right.
my speech, but I will start feeling nervous, feeling fear, worry about my speech probably few weeks before the day I should do my speech.
Mm-hmm.
And after I've done my speech or presentation, I continuously feel nervous, fear or worry about whether I've done it correctly, whether people like the way I presented my presentation. So I have that nervous fear and worry continuously, not only situational basis. So these are the differences between shyness, nervous, and anxiety disorder. And people who have anxiety disorder also, the level of avoidance are a lot higher. People with anxiety disorder, when they are unable to cope with their fear and worry, they tend to avoid. If previously someone with anxiety disorder only have a mild or moderate symptoms of anxiety, they may avoid some situation probably one or few times, but when the intensity become more and more, and when they don't treat that symptoms of anxiety, the avoidance level become more
Right.
and more until they do not want to do anything, until they may not want to come to class and do anything and see other people. They may avoid themselves from experiencing um, situations that may trigger their anxiety,
Mm-hmm.
and because of that they avoid and they isolate themselves. This is the severe levels of
Cases.
anxiety. Yeah. uh,
So basically, one is situational and one is more like internal, right?
One is situational, one is more continuous in nature,
Right, right.
and it is more generalized. It is more generalized. Not only one situation, but also before the situation happen. Also, people with anxiety disorder may feel worry, unnecessary worry.
Is there such a thing as post anxiety, like after the incident?
Post anxiety. There are many terms that people use.
Mm-hmm.
Uh, People with anxiety, they feel anxiety before, during, and after the
Oh.
situation. So if you would like to call it post anxiety situation, also okay. Because people with anxiety disorder, they will feel nervous, they will feel worry, fear, before the event, during the event, and after the event. And it may continuously happen, and that is the reason why it disrupt their function, disrupt their self-care, because they are always in distress. So the word disorder here refers to feeling of distress. Yeah,
Okay.
continuously feeling of distress. We feel uncomfortable with the stress that we continuously feel, and it affects our function.
Ah, okay,
Uh,
okay. So that's the cutoff point, right? Where you're no longer able to like carry out your daily life.
yeah. Nervous is okay. I'm also nervous before, I want to deliver this speech. But I think that is normal. If we learn about positive stress and negative stress, or what we call distress and eustress. Eustress is very good for us to prepare ourselves before, before our performance, before
Mm.
we submit our assignment. If we have this eustress, a bit of nervous, a bit of anxiety, I think that is very good, so that it may
Mm.
make us more motivated to complete the assignment in the best way that we can. Uh,
Okay. So I hope that clears up the question. Now I'm gonna move on to the third question. Doctor,
yeah.
how exactly is anxiety different from, let's say, other mental illnesses like depression, psychotic disorder, or maybe like bipolar?
Mm. Well, if I would like to elaborate on all the differentiations, we may need to do what we call psychopathology 101 course. Yeah,
Mm-hmm.
because different disorder have different characteristics. But bipolar disorder, schizophrenia, psychotic disorder, and the difference between psychotic disorder and neurotic disorder. Anxiety disorder, depression fall under neurotic disorder. Bipolar, schizophrenia fall under psychotic disorder, whereby this psychotic disorder normally have the element of delusion, have the element of hallucination, and normally the treatment must involve pharmacotherapy, medication. Yeah.
Right.
But anxiety disorder or depression is a neurotic disorders, whereby sometimes in research we have found that certain people can be treated using psychological therapy alone,
Okay.
without medication. But I cannot deny that the literature have found that a combination of psychotherapy and pharmacotherapy is considered the best treatment modalities for anxiety and depression at the moment. But there are evidence that people with depression and anxiety, they can treat the symptoms with psychotherapy alone. Uh,
Oh.
so these are some of the differentiation lah, yeah. Uh, and another differentiation that can distinguish anxiety and depression.
Mm-hmm.
People with anxiety, normally they tend to focus on future more. Yeah, they
Okay.
are worried about their future more. Whereas people who are depressed, they feel guilty about their past. That is the
Okay, okay.
psychological um
Difference.
difference. Yeah. Apart from this, in terms of the psychological features that can distinguish anxiety and depression, anxiety worry about the immediate or long term future,
Hmm.
but depression, they assume that the future is hopeless.
Right, right, right.
Uh, so anxiety, they may not feel that the future is hopeless. They think that, oh, what will happen? There's a lot of uncertainty. There is a lot of unpredictability. There's a lot of uncontrollability. So these are the things that make people feel anxious. And we are in the COVID-19 era, and people are prone to have anxiety because of this. We are not
Mm.
sure when the previous norm can, can we can exercise the previous norm again. So a lot of uncertainty, unpredictability, and uncontrollability of the future. So these are the characteristics of anxiety.
Right, right.
Uh, and for depression, people may have lack belief that positive experience may happen in the future, either to their world, either to their self, or either to other people.
Mm-hmm.
So they may have this they may have these symptoms of worthlessness. It's not worth it. It's not worth it to take care of myself, because
Mm.
I'm hopeless. I don't have any
They give
future.
up, right?
Yeah. So these are the psychological distinction between people who have depression and people who have anxiety. But let's go to the physical distinction.
Mm.
Physiological distinctions, we can see the differentiations even better in physiological features. People with anxiety, they have heightened arousal. Their physiological experience are heightened in nature. For
Mm.
example, they may have muscle tension. They may have some intestinal distress. They may feel nauseous. They may feel constipation. They may experience diarrhea. They may also have dizziness. Yeah,
Mm.
and their heart rate may increase. Racing heart rate, racing thoughts. They may have shortness of breath, and they may also experience difficulty in concentrating because they have racing thoughts.
Right, right, right.
Yeah, but people with depression, the physiological symptoms are different. People with depression, the physiological symptoms such as they may lose their appetite. And because they lost their appetite, some people lost significant weight.
Mm.
Yeah, and this doesn't happen intentionally. They do not involve in diet. Yeah, either they lost appetite or they have significant increase of appetite and make
Right.
them feel they gain weight. Yeah,
Mm.
unintentionally. They may also have lack of energy. Their movement may be a lot slower, and that is the reason why sometimes we can see that people with depression, sometimes they just lie down and sleep throughout the day. Yeah,
Right.
either they sleep more or they sleep less, depending on people. And they also have difficulty to concentrate, but not because of the racing thoughts, but because of the ruminating thoughts.
Can you
They
explain what ruminating means?
they keep thinking about, for example, they keep thinking about why this happened to me, why I'm being chosen to experience this, what did I do anything previously that God punished me,
Mm.
and I shouldn't have done that previously. I should have this. I should have choose this instead of that. So racing thoughts is like more of what will happen in the future. What should I do?
Mm.
So it is more of people with anxiety think more about the future, things that are things that are beyond their control, but they think about it very much.
So what I'm getting is like anxiety is basically more, forward thinking. Like they don't like the sense of unknown, whereas like depression, bipolar, it stems from, internal issues. That's correct, right?
Well, anxiety disorder also deal with internal issues. So when we talk about internal issue, thoughts is actually internal issues. Um, uh, if we refer to the timeline in terms
Okay.
of time, yeah, um, people with anxiety care a lot more about future, what will happen in the future, and they feel fear and worry because they don't know what will happen in the future, and they don't feel easy with that. They don't feel easy with something that cannot be controlled. They are very um, they may be very structured, and they need to plan everything. If they can't plan everything, they may start to feel anxious.
Right,
It's
right.
more about the future. But people with depression, they um, they think more about the past.
Mm.
And yeah, so you have your friend there, I think Lipi or Emma have defined the ruminative thoughts. What is ruminative thought? Something about repetitive in nature. So
Uh, okay, okay. So now I'm gonna move to the fourth question. What are the major causes of anxiety among students and workers nowadays? Why do you think it's so common compared to like maybe 50 years ago?
okay, when we talk, the word cause is very big
Vague.
word here. Yeah,
Yeah.
cause. Yeah. If we talk to someone in public health area, or
Mm.
epidemiologists, causal factors may mean different from our layman definition. Yeah.
Right.
So when we use the word cause, it means like it has cause and effect. It's a confirmed thing. Yeah.
Right.
Causing factors according to the epidemiologists is an event, a condition, or characteristic which the disease would not have occurred if the event is not there. Yeah.
Mm-hmm.
So in anxiety disorder or mental disorder, normally we do not use the word causal factors. We normally use the word contributing factors, associated factors, or risk factors. What are the factors that may contribute to the development of anxiety symptoms or anxiety disorder? Because we want to be careful on not pinpointing one causal factors, because studies have shown that we cannot do that.
Right.
There are a variety of causes. Different research have found different contributing factors. If we learn regression analysis in psychology, we know that sometimes when we run regression analysis on certain variables on anxiety, uh, that variable maybe contribute to only 11% of anxiety disorder as a whole. So what if it is only 11% of contributing factors of anxiety disorders? So what are the other 89% of contributing factors? So we need to be very careful on saying that this is the cause or this is not the cause. So let's use the word contributing factors.
There's
And I
not
would
it's
like,
not
is it okay?
right.
It's
Continue,
not
continue.
causing,
Sorry.
yeah. Yeah, so it is not a causal factors. It is more of contributing factors. Is that
Right.
okay, Aaron?
Yeah, yeah, it's okay, it's okay. And
Okay.
do,
Uh,
do you think it's, maybe evolutionary, like because of technological advancement or like lifestyle changes that people tend to have it more often than they do back then when times were more simpler? Do you
yeah,
think there's a correlation?
yeah, I agree with you that I also personally believe that we are now we are now living in a very fast world. In a very fast world, some people said that this MCO make them feel their life a bit slower than usual. For me, I think that it's about the same. Today is Tuesday, and I don't remember much what I have done on last Tuesday because it moves
Okay.
very fast. We have been in this MCO for more than 50 days. So I was
Right.
like, wow, 50 days, that is almost 2 months. And I think, yes, we live in a very fast world. When we live in a very fast world, we may not able to take some time to think about ourselves and our self-care. We may keep trying our best to deliver, to try to achieve something that may be related to people's expectations. We may live due to people's expectations. Oh, I have achieved this because my boss say this and that. Oh, I have submitted this assignment because I need to submit this assignment. So I think there is a correlation. But what I would like to show to you today, is it okay if I share my screen?
Yeah, sure, sure.
Okay, because I would like to show to you my paper, my systematic review paper on the prevalence rate, associated factors and predictors of anxiety. What happened to the screen? Okay, let
Um,
me. Okay, yeah. Okay, let me share my screen.
mm,
The paper is yet to be published. I'm trying my best to make sure that this can be published. Hopefully soon. Are you now able to see my screen?
yep, yep.
Okay. So this is my paper on the systematic review of prevalence rate, associated factors, and also predictors of anxiety disorders. And when I did this systematic review, I have differentiate university students versus general community and versus clinical populations. Yeah, there is a lot of research on prevalence rate, associated factors, and predictors of anxiety and anxiety disorders in Malaysia. Let me see what are the unique. Okay, these are the unique associated. If you can see on our screen now, there are few other unique associated factors related to anxiety. The higher up is more on the socio-demographic factors, but this is very much on reviewing the previous studies that have been done in Malaysia. You can see that the additional unique associated factors related to anxiety. Number one, in study one refers to study on university students, is academic related stress. I think students now have high stress
Right.
in relation to their academic life. So academic related stress has been found to be associated with anxiety. Extracurricular inactivity also has been found to be another unique associated factors among students.
Mhm.
Yeah, so in my class I always stress this point. I said that in extracurricular activity, this is where you expose yourself with with other people, because part of the symptoms of anxiety is avoidance and isolation. Yeah, isolation is also part of depression symptoms. But when we involve in extracurricular activity, it allow us to be more exposed with other people. Somehow or other, it force us to speak to other people and do other stuff other than our academic life. If we involve in physical activities, it's even better, because science has proven that when we involve in exercise, yeah, 30 minutes brisk walking, 30 minutes cardiovascular activities may secrete certain good hormones, such as endorphin hormones, that may make us feel nice, feel comfortable, feel happy, and that can reduce anxiety feeling or emotion with us. So if someone inactive in extracurricular activity, it may they may trigger some anxiety symptoms among university students. And there are so many studies have been done on medical students, and students in preclinical years. Preclinical years, I think the meaning is before they go to hospitals and apply the skills that they have learned in classes. Yeah.
Mm-hmm.
So people in medical students who are in preclinical years also uh, have higher symptoms of anxiety, probably because of the demand in submitting assignment and whatnot. Low self-esteem, perceived stress, and depression also associated highly with anxiety. Limited support from co-worker and supervisor if you're talking about people who are working.
Mm-hmm.
So if we get limited support from our colleagues, limited support from our supervisor, when our supervisor have less compassion, have less empathy, it may also trigger anxiety. In clinical studies, clinical studies at hospital, women with obstetric complication, in other words, when they are pregnant or expecting, when they want to deliver their baby, if they have complications, this may also trigger anxiety. Having diabetes for more than 2 years and physical inactivity among people with chronic illnesses also
Okay.
open them for anxiety. So if you can see this within one paragraph, we can see that there are so many contributing factors of anxiety. Yeah. So this is associated factors. Let me go down. Let me go down and show to you some other predictors. When we say predictors, this is very much related to statistical analysis. Yeah, we have other unique contributing factors that are more intense, that are more strong if compared to the associated factors. Interpersonal problems such as unhappy relationships with family and domestic violence also may expose the person to have anxiety. Family history of mental illness, as we have discussed at the beginning of our session, this also may predict someone to have anxiety disorder. Psychological problems, chronic physical illness such as cancer, gestational age below than 20 weeks. In other words, that um, the expected delivery date of women who are expecting, if they deliver their baby very much early, so this may also expose them to have anxiety. Again, physical inactivity is a predictor of anxiety in Malaysia. High psychological job demands, job insecurity, as how we predict that this will happen during this COVID-19 era, may expose or may develop anxiety disorder among people. And it is very interesting to find that non-organizational religious activity and intrinsic religiosity also can be one of the predictor of anxiety disorder. So there's a lot, Aaron. There is a
Okay.
lot
Okay.
of contributing factors of anxiety, and that is the reason why I am very careful to say that, oh, only these
Mm.
causing anxiety disorder. No, different people have different life. They may have different factors that contribute to the development and maintenance of anxiety disorder. So I hope that answer the question.
Yep. Yep. For sure. For sure. Can I
Uh,
share my screen now?
yeah, yeah,
All right, doctor. Actually, like we're a bit slow, so I think we're gonna have to speed up the questions a
sure,
bit.
sure, sure.
So, okay, this one's highly requested. Many people have panic attack for no apparent reason. What exactly triggers a panic attack?
Okay. I will try to speed my presentation, and again I would like to share the screen here to answer this question.
Okay, okay, okay.
Um, so can okay. All right. If we refer to this screen, yeah, coming from a background of cognitive behavioral approaches in psychology, Aaron, we have so many theories. Okay,
Mm-hmm.
we have Sigmund Freud with its psychoanalytic theory. We have Watson with behaviorism theory. So this is something related to cognitivism, another theory. So why? How come people get panic attack without certain reasons. Yeah, so we can see in this cognitive model of panic. Let go through the model. Yeah, for example, like if someone have a relevant personal history of the father of someone was a smoker, and the father was experienced gasping for breath when he died. Yeah, and the son or the daughter sees that, and that may be traumatic in nature for him or her. Yeah, so whenever that the person, the son or the daughter, notice a tightening of the lungs, that may trigger, that is an internal trigger of a panic attack of that person. For
Okay.
example, when the daughter noticed a tightening of her lungs, suddenly she perceived that, oh, I may also die as how my father died.
Mm-hmm.
I may be not able to breathe. I'm suffocating now. And because of that perceived threat, yeah, the person feel anxious, very apprehensive. And when the person feel anxious and apprehensive, so the body will also continuously show symptoms that is related to the perceptions, our psychology perceptions. Oh, I feel anxious. The body also started to show symptoms of anxiety, such as
Mm-hmm.
racing heartbeat. When we become anxious, our chest becomes tighter. Yeah,
Right.
and because of that physiological sensation, the vicious cycle becoming more intense. We started to believe that yes, I may die. The symptoms becoming more intense and intense. I probably will die, same as how my father died. And because of this catastrophic misinterpretation, and people are in vicious cycle that develop the panic attack. So as a summary, when someone catastrophize the threats that we face in our daily life, and this threat can be as simple as feeling uncomfortable with our physiological sensations, such as we started to feel like, what happened to my heartbeat? Why
Mm-hmm.
suddenly palpitate? Why suddenly I'm sweating? So if we catastrophize these physiological sensations, and we believe that we are going to die, or we are going to face a very catastrophic event after this, that leads to panic attack.
I see.
Mhm.
Okay, so Doctor, due to time constraint, do you want to continue with the questions, or you want to move on to the open questions?
Well, it's up to you. It's up to you.
Okay. In that case, I'm going to do one last question before we proceed to the open questions. Is that
Okay.
okay?
Sure, sure. I've seen Dr. Alvin now. And Dr. Alvin was, he is still my mentor. And
Okay.
I have been supervised by her previously when I did my master's in clinical psychology.
Hi, Dr.
So,
Alvin.
Hello, hi everyone. Sorry I'm late. Many other things to do. I just thought I'd drop by and say hello. Hi Jamilah, welcome. Thanks
hi,
for doing
Prof.
this for us.
It's my pleasure, Prof, to share whatever that I know. I'm not an expert, you are an expert. So I only
No,
share whatever that I have learned for the past few years in my PhD degree.
I need to confess, I'm not an expert myself also. So you've been cheated all this time.
So if you are not an expert, then I don't know who I am. So probably I'm just a presenter for today's event.
It's an existential issue.
So I need to see my therapist after this.
Exactly. Yeah. Do
So
let your other colleagues know if they are interested to provide us with any seminar, webinar. It's nice to exchange knowledge here and there, updates, because I am totally outdated. So yeah, and I'm sure the students would benefit from all of this.
we will continue this collaboration, and probably after this, it's UIA turn to invite someone from Sunway.
Yeah.
Okay.
So, okay, Aaron.
So I'm going to move on to the last question. Okay.
Mm-hmm.
Okay. This one's going to be a bit tough, but Why don't you try your best to answer this one?
Yeah.
Now, a lot of people are, wondering, is it actually possible to cure anxiety completely? Maybe they heard it from their friends or they searched it online and they start, going out and buying those pills and eating it instead of actually consulting a professional or getting treatment. Do you think that is possible?
Okay. Number one, please do not buy any anxiety medications on counter without professional advice. So we are not sure whether that medication is actually relevant, suitable for our body, for our symptoms. Yeah,
Mm-hmm.
I don't think that psychiatric medications can be found over the counter unless the place that are selling it involved in illegal activities. Okay,
Okay.
so this psychiatric medication can, you can purchase with prescriptions from psychiatrists or medical practitioners. Even I cannot prescribe you with medication. Even Prof. Alvin also cannot. Yeah. So that is number one. Please take care of yourself. Do not buy any psychiatric medication over the counter. Number two, I think I need to be very clear on my position as a clinical psychologist. I may be biased, yeah. My answer may be biased, but it also being supported with evidence based on the literature that I have read, based on the research that I have conducted. I disagree that anxiety can be, the word cured is also again very strong. Anxiety disorder is not only biological disorder, it's a combination of biological disorder and also psychological disorder. So it is not like cancer, it is not like diabetes. Yeah, even people with diabetes also suffer from psychological issues such as anxiety and depression. So when anxiety disorder is a combination of biology and psychological symptoms, so we need to have psychotherapy as part of the treatment. And based on the meta-analysis and also the systematic review that I have read, um, anxiety disorder is best to be treated with a combination of both pharmacotherapy and also psychotherapy. And in fact, in my research during my PhD, I have just completed my PhD 3 years ago. So in my
Okay.
PhD, I compare three groups: the experimental group, experiencing or being given, I conducted the group cognitive behavior therapy, and they also continuously take their anxiety medication or psychiatric medications that has been prescribed by their psychiatrist. Yeah, and comparison group is relaxation training with medication, and the control group is treatment as usual or pharmacotherapy alone. So from my research, I have found that CBT with medication has a greater effect size or more effective if compared to the treatment as usual or pharmacotherapy alone. So in psychotherapy, what we know that it also teach the person to have skills on how
Okay.
to manage anxiety when the pills or medications is not around. When we are experiencing anxiety symptoms such as sweat palpitations or trembling or leg shaking, probably relaxation training such as progressive muscle relaxation can be used whenever that we forgot to bring our medication. So psychotherapy teach skills that people can bring and use throughout their life when the medication is being stopped by the medical practitioners. So, um, my conclusion is, please, if we have psychological disorders such as anxiety disorders or other mental disorders, try our best to reach out to both medical practitioners and also psychologists or other mental health practitioners.
Okay. Okay.
So,
All right. Got it. Got it. Okay. So thank you for clearing that up and answering our questions. This is going to conclude all the questions from me. Now we're going to proceed to the open questions.
yeah. So you are going to read the open question?
Yeah, wait, give me a moment. Like
Yeah,
something
sure.
hang.
Let me just say that psychologists do not normally come very cheap, and here you have got a totally free session.
Yeah.
So please ask questions when you have the time. Otherwise, you're going to make an appointment and pay Jamilah lots of money.
All right. Once again, please enter the code or scan the barcode to have your questions answered. I'll give you guys a few seconds and then I'll pass it to Dr. Jamilah. Thank you. Okay, so doctor, we've got a lot of interesting questions today. Is there anything that catches your
Wow.
eye? Anything you want to pick out?
Mm, or probably you can just pick up for me
I'll
lah.
pick
Aaron,
out.
too many,
Would you want?
many,
Would you want me to read it out for you?
something that are probably different from what we have presented lah, or what
Oh,
we have
okay.
discussed.
Okay. For sure.
Aaron, can all these questions be saved?
Yeah.
Can, yeah? I mean, you're
Yeah.
recording this whole session, right?
Right.
Yeah, okay.
Yeah, and then you can invite other people to answer this question.
Okay. Let's do with the first question. This is quite interesting to me. What is the
Okay.
best way to treat children with anxiety disorder?
Wow. What are the best way? When I see the word best way there, I need to be very careful with what I'm going to say. Mm, there is no best way for everyone. One children may have different way to be treated, and it's very much depending on the family dynamic, on the resources that the parents have, also depending on the parents' socio-demographic factors, the way the parents understand about it, and also the age factor of the children, how matured the children is. But coming from cognitive behavioral training, children with anxiety disorder probably can learn. The parents can also do relaxation training with their children. If I can share with you my daughter's name is Nisa. She is someone who is quite introverted in nature, and she is
Right.
also someone who have who have some symptoms of anxiety. When she was a child, she also become a victim of bully. So what did I do as a mother who have been trained in this area? Every night we will do breathing together, and we will use an app such as Calm app or Insight. Insight apa nama tu? Insight. Any apps will do lah. Any apps that you can do, you can use to regulate or retrain the breathing, do some meditation with the children. And we have found that in mindfulness based intervention for children with anxiety disorder and also in ADHD, mindful breathing may also help to reduce some of the symptoms. Apart from relaxation training, such as retraining of breathing, talking to children, discussing about their perspective on certain situation, and during the discussion, teaching them on not taking everything as a fact. Yeah, uh, probably offering them a different perspective on ways to see things differently may also reduce some catastrophic thoughts or negative thoughts or irrational unhelpful thoughts that they have that may lead to the development and maintenance of anxiety. My daughter until today will ask me, is that a fact or is that a perception, mom? I think that is only your perceptions, right? When people say, when you say that people may perceive you negatively. So understanding about the difference between fact and also perceptions may also help um, children who are mature enough to be more relaxed in perceiving certain situations that can trigger their anxiety. But the simple thing is relaxation training, and also reading storybooks that have the element of social stories, how certain children, if the storybook may need to have the character may need to be is a bit more effective if the character is also the same gender with the child, and how the character in that storybook manage the symptoms of anxiety that they have. This is also helpful. Bibliotherapy is also helpful for children with anxiety disorder. So it's a
Okay.
combination of many strategies, and the best strategies is very much depending on different children. We need to keep trying.
So I'm gonna ask this, in the interest of parents, right? Because there are many cases where the child displays symptoms of anxiety at an early age, but as he gets older, those symptoms, they're no longer present. Like, how do they go about it? How do they decide, whether he should go for this or that, whether he should go to this school, whether he should go normal school, whether he should take this, whether he should take that? What are your thoughts on that?
I believe in discussion. I believe in asking our children on their opinion, because they are the one who are going to this school and that school and experiencing and make friends and facing different kind of teachers. So asking their opinion, but if we don't have resource, if we don't have much choice, preparing them earlier before they go to school by talking to them and bring them to school gradually, and preparing an opportunity for them to come back to us and share what is their experience at school, is something that is very, very great as a parents. So we
Right,
need
right.
to provide that time, provide that safe space for our children to come back to us and talk about their experience.
Okay. So I'll be moving on to the second question, okay?
Okay.
Okay. Can we do this one, the middle one?
Okay. How well does emotion regulation help with anxiety symptoms? Has it been successful in your research? The term emotion regulation, even in CBT also, probably when we do relaxation training, when we identify the negative thoughts or unhelpful thoughts, and try to restructure to a more helpful thoughts, this is part of emotion regulation as well. And of course, the simple answer is it is successful. Emotion regulation help anxiety symptoms, and it has been found to be success not only in research in Malaysia, but also in research in overseas. So these are the skill that yeah, everyone should learn to regulate our emotion since childhood. So allowing the child, allowing the adolescent, allowing the young adults to experience different type of emotion, such as feeling failure, feeling anxious, by exposing them to certain situation that may trigger uncomfortable emotion, and learn on how to regulate that, may also develop us to be more resilient to face the future
Okay, Doctor,
rather
can
than
I can I interrupt for a second? We're
yeah,
actually running out of time. Can we just
yeah,
quickly go through maybe two more questions quickly, briefly?
yeah, okay.
Wait, so that we, more people get a chance to have their questions answered. Okay, let's do this one. Just briefly, quickly.
If my therapist insists that I do not have anxiety, okay, let me close my chat box. I can't read it. If my therapist insists that I do not have anxiety, but I feel like I do because I get very anxious in certain situations, what should I do? It seems like he's downplaying my situation. I'm so sorry that you feel that way. Well, if your therapy, you probably can discuss with your therapist. If your therapist insists that you do not have anxiety, then what do you have that may reflect your current situation? And if you think that your therapy sessions is not therapeutic, probably you can also find a second opinion about it. Um, yeah, that is my suggestions. You may need to discuss if you don't have anxiety. So whatever that you feel now it's what is there any name, or is there any certain labels that you and your therapist can discuss together that may make you feel like, oh, I probably don't have this, I may have that.
Okay.
Some therapies may use techniques such as confrontation or arguments. Depending on the school of thoughts, they may have different ways in providing psychotherapy. But if you find that this situation make you feel uncomfortable continuously, and it doesn't helpful, probably you can find second opinion.
Okay. So, doctor, we're actually running out of time. Can you do this the honors in choosing the last question?
Okay, Aaron, is it okay if I continue with our last question, Aaron,
Yeah.
on what you can do, because this is, mental illness or mental health problems
Right.
is still stigmatized in our current context. So what
Mm-hmm.
you young adults can do so that we are more ready to face our future. So what I
Okay.
would like to suggest on how to overcome the stigma of mental health problems or mental disorder, mental illness. I would like to suggest that we, doesn't matter whether young adults or children, to be exposed and to learn about ourselves more. So mental health is part of ourselves. Yeah, as how we learn to take care of ourselves physically by exercising, by dieting, by taking enough water and whatnot. So learning on how to care for our mental health is also important. So read a lot about mental health, and also talk about mental health with your friends, people around you. So when we talk about this more, uh, things can be more normalized in nature. So from time to time, it may take some time for other people to consider that this is not a taboo or have stereotype when people talk about mental health issue. So read more, talk more with people around you about mental health. Talk also to people who have similar experience. You can have your own support group to check among yourself and share the experiences that you have. And also don't forget to talk to professionals like Dr. Alvin, your counselor, your clinical psychologist, and inviting people like me to talk about this in your university. So by talking more about this issue, hopefully we will be able to destigmatize mental illness very
Mm-hmm.
soon.
Right.
And don't forget to be an advocate of mental health. Be an advocate. Talk about it in your Facebook, Instagram, openly.
Okay. All right. So that's it, right?
Yeah.
All right. So, guys, sorry, guys, due to time constraint, we're gonna have to wrap up the Q&A session. But I'm sure Dr. Jamilah wouldn't mind explaining it on some other time when she's here. Right now,
Yeah.
can we just take a minute to answer this survey as a token of appreciation for Dr. Jamilah being here with us today completely free of charge? Can we
Thank
guys
you
take a
so
few
much.
seconds?
Thank you so much if you are willing to spare about 15 to 20 minutes of your time
This
to do
survey
this.
is actually carried out by 100 psychologists from 70 different countries. So doctor, maybe you want to explain a bit more?
At the moment, yes, this global research effort to fight COVID-19 Corona study, the objective is to understand what are the psychological factors that may contribute to different behaviors that we can see during this COVID-19 or lockdown in the whole world. And we would like to find out what are the psychological factors that may help us to curb this pandemic better in the future. Behaviors that we have, certain psychological factors that we have, and hopefully this information we can share with the higher authority that in order to um, curb this pandemic from more outbreak. So we need to learn these certain types of psychological or psychological factors or behaviors, because pandemic is actually, the outbreak is very much related to our thoughts, our feeling, and also our behavior. If we don't believe in social distancing as how we can see in certain countries, that may trigger the outbreak to be more and more. Yeah, the number of died cases can increase because we don't believe in social distancing. We don't really believe um, in care about our hygiene. So based on Stephen Taylor, this is a psychologist from Canada. He has written a famous book on the psychology of pandemic, and that has been just published on last December 2019. Yeah, and he said that pandemic is psychological in nature. Um, we get this outbreak because people behave unhelpfully. People do not confine themselves, people do not do social distancing, and because of that we transmit these viruses from one person to another person and makes the number of cases higher, and it become from epidemic, now it become pandemic because of our psychological factors, because the virus for COVID-19, it is not airborne at the moment. I'm not sure if it has mutated to become airborne, but previously it is not airborne. It is transmitted from one individual to another individual, from touching, from sneezing, coughing. So if we don't protect ourselves, if we don't confine ourselves and do social distancing, and we take care of our hygiene, the pandemic will become more and more.
I see.
So that
So,
is
all right.
the reason why the research is being conducted.
I see. So, all right, guys, our webinar has now come to an end. We would like to thank Dr. Jamilah sincerely for taking time off and being with us here today. Likewise, all of you, thank you for being with us here today. We hope you gained something, learned something from today's session. And just before you guys go, can I have you guys turn on your webcam, and we're going to take a screenshot of today's session. So, all right, I'm going to start. 1, 2, 3. All right, I think that's it. Thank you once again for stopping by. For more information, please visit Sunway Psychology Club on Instagram for more details and information. If you like today's video, please follow us on Instagram, give us a like, shout us out. That's about it. That's going to be it from me. Bye, guys.
Okay, thank you so
very
much.
much, Dr. Jamilah.
Thank you so much for your time.
Thanks,
Thank you,
Jamilah.
Doctor.
Thanks, Aaron.
Thank you, Prof.
No worries.
Thank you, Aaron.